In this section, I'll be talking about some of the ways that it's possible to live better with COPD. Although there is no cure for COPD, it can be managed. Remember, it may take time for you to feel a difference, but with small changes in your lifestyle and the right medicine, you can change the way you feel for the better. Everyone on our team will work with you to help make that happen. Quitting smoking. First, if you are a smoker, the most important step for managing your COPD is to stop smoking. Medication and lifestyle changes can help you manage your COPD, but if you are still smoking, there's only so much they can do. I understand how difficult it is to quit smoking. If it were easy, then you probably would have done it a long time ago. Quitting smoking is not just a matter of willpower. That's because nicotine, the main chemical found in tobacco, is a highly addictive substance. Many people try over and over again before they are finally able to quit. If you've tried to quit before, it's important to keep trying. We have programs to support you and help you quit for good. Although it's true that some of the damage caused by smoking will never completely go away, there are still a lot of benefits to quitting. Here are just a few that relate to COPD. 20 minutes after your last cigarette, your heart rate and blood pressure will drop. Between 2 weeks and 3 months after quitting, your blood circulation and lung function will begin to improve. Between 1 and 9 months after quitting, you'll begin to cough less and breathe better. Remember, quitting smoking is important, and getting on a treatment plan for COPD and sticking with it is just as important to help you feel better, faster, and over the long term. If you feel like you need help to stop smoking, we will work together to come up with the plan to help you quit. In the meantime, you can visit smokefree.gov to learn about some successful strategies to help you stop smoking for good. Our office also has a program to help you stop smoking. If you want to learn more, write it down on your list of questions so that we can discuss it during your next office visit. Educating yourself about COPD. Remember that with COPD, knowledge is power. I recommend that you try to learn everything you can about COPD. Try to understand your COPD and how it affects you personally. Understand what is happening in your body and know your triggers. Does cold air bring on your symptoms? Do certain activities make it difficult to catch your breath? Knowing ahead of time means you can have a plan for when your COPD symptoms suddenly get worse. Managing COPD through diet. Being overweight or even being underweight can make it more difficult to manage your COPD. Eating a well-balanced and healthy diet can help you stay strong. The American Association for Respiratory Care recommends the following diet for people with COPD. Eat foods that are high in protein, like milk, eggs, and dairy, to help keep muscles strong. Drink plenty of water unless we tell you otherwise. Try to limit your salt intake. Limit your intake of foods that are high in sugar, like soda, candy, or bread. Avoid foods that produce gas or make you feel bloated. In addition, our clinic offers a program to help people make healthy eating choices. If you're interested in hearing how this program can help you, write it down on your list of questions so we can discuss it next time you're in the office. The importance of exercise. Certainly, COPD can make it harder to breathe when doing certain activities or exercises. However, even light exercise like walking, stretching, and low-impact strength training can help make it easier to breathe. Please talk with us if you're interested in enrolling in a pulmonary rehabilitation program. Your rehab specialist will help you figure out what type of exercise is best and even help create an exercise program that's right for you. Relying on your support system. It's not uncommon for people with COPD to feel sad or depressed. If you ever feel overwhelmed by your condition or have trouble shaking feelings of disappointment or depression, let one of us know. We all have feelings like this from time to time. They are common when people with COPD are first learning to live with their condition. We can help you find a way to cope with these feelings if needed. It's also important to have a personal support system or caregivers you can turn to. Interacting with friends and loved ones can go a long way towards helping you feel better. If you don't have a support system like this, please let one of us know. We want to help. Taking medicine for COPD. Taking medicine as directed is an important part of any COPD treatment plan. The right medicine can help control your symptoms and help you breathe better. There are two main types of medicine for COPD. Rescue inhalers, which contain medicines that you take when you feel a sudden onset of symptoms, and daily inhalers, also called maintenance medicines. These are medicines that you take every day, whether you feel symptoms or not. They can help you control your COPD symptoms over the long term. For these medicines to work as intended, it's important to take them every day and not miss any doses. It may help to make it a part of your daily routine, like brushing your teeth. If you do it at the same time every day, you'll be more likely to remember to take your medicine. We'll learn more about these devices in later sections. Using your daily inhaler can feel like a big commitment. There are times you will inhale the medicine but may not feel a difference. But you should trust that the medicine is working. It is helping you stay in control of your COPD and to breathe better. Taking it every day gives you the best chance of improving your condition. I know that change can be hard. Even after a diagnosis like COPD, you may find it hard to continue making healthy choices every day. And that's okay. Real change doesn't happen overnight. It's a process. If you have a setback, don't let it undo your goals or the progress you have made. And if you need help coming up with a plan for healthy living, we are here to help. In the next section, you'll hear about how to use a specific inhaler.